I'm Christina Roman, and this is the Outreach Breakout Session, and the chair of the Outreach Committee this year was Kristen Dunn, who's an adult with CF and who couldn't join us live today because she's a brand new mom, but she did record a welcoming statement for us that we're going to start with.
Hi, and welcome to the Outreach Breakout Session. My name is Kristen Dunn, and I'm a 35-year-old adult with CF who had the honor of being the chair of the Outreach Committee this past year. I'm even more honored to pass that title along this year to Linda Bowman, an exceptional CF adult and a personal friend. I'm very passionate about the importance and significance of community voice and of outreach. You've most likely been invited to VLC because of your excellence in fundraising. By joining Community Voice, you'll be able to influence where that money goes and how it is being used. You'll have the opportunity to voice to the foundation what is important to you. Our outreach committee this past year did a peer-to-peer outreach activity. A few CF adults each personally reached out to a few other CF adults to tell them about their experience in Community Voice and ask them to join. It was successful, much like the personal ask in fundraising. Outreach is so important because only by having a diversity of opinions can we truly represent our community and ensure that all foundation activities truly reflect and meet the community's needs. So, I hope by listening to the amazing speakers to follow that you'll see how influential Community Voice can be. And I hope it inspires you to join us and help us in our outreach activities going forward. Thank you so much.
All right. Well, welcome to everybody in the room and those of you who are online. We have one online panelist, Chad, who's also joining us. And we're just really excited today to talk about some of the new ways that we're working to engage the community and bring the voice of the amazing CF community into all of the work that the foundation is doing. So we will be taking questions at the end of the session. To submit questions, you can submit them at cff.cnf.io on your mobile device. And you'll just want to select this session, which is the outreach breakout. And we'll have time at the end for each of the panelists to answer any questions. So what we're going to talk about today is Community Voice, and this is a group that provides people with CF and family members of people with CF the opportunity to have an active say in all foundation initiatives, ensuring that the voice of our community is what is being used to drive innovations and improvements in our work. This group got started a little over 2 years ago, and there were several of us at the National CF office who wanted to include community members in different projects, ranging from the registry research project to a patient engagement advisory committee and the CF adult advisory committee. And we realized that, we often were going to the same people over and over, and we really wanted to open it up so that all people had the opportunity to get involved in the work that we were doing. So we started a group that was called the CF Adult and Family Advisors, and it was originally intended to bring people into the different committee work. Then new committees formed, and then soon we realized, we have all of these different projects that we need input and advice on how to move forward on. And so this group evolved from a way to bring in new community members to a group that's truly being used at every point in these different projects to get the feedback of the community so that we're crafting things that are truly meaningful and embed the voice of everybody in our community in them. So this week, actually today, we are officially changing the name from the Adult and Family Advisors to Community Voice. Community Voice was the name that was chosen by the CF Adult and Family Advisors, we asked them to give us feedback on what they felt it was like to be a part of this group and what it meant to them. And the words that we kept hearing over and over again were community and getting to share your voice. And so that's why we chose the name Community Voice and are thrilled to be launching that today. So why join this group? This group gives people an ability to have an active role in shaping resources for the CF community. You're able to provide input on topics that mean the most to you. You can share your unique experience. Everybody has a different experience with CF. It affects people different ways. And so it's important to us that we hear from a broad range of people. And it gives you the ability to learn about new initiatives and have a say early on and truly make a difference, which is what this group is all about. To sign up, members can go to cff.org/community voice, and we have a form for people to fill out that has some basic information about your connection to cystic fibrosis, some of your personal experiences, basic demographic information, personal and professional background. So if there's areas where you have expertise, we know that and we can bring you into those areas. And then based on the information we get in that sign-up form, we're able to send specific asks that are targeted to your background and experiences. On the right-hand side here, you can see some of the top 5 areas of interest of people in the CF voice group, and it is a range of topics that are covering a lot of the major things that the foundation is working on. So everything from how to improve CF care to public policy and advocacy to the research space to what programs we're doing for adults with CF and mentoring and things like that. So we're really touching on a wide range of topics. Who should join? This group is for the people that are living with CF day in and day out. People with CF, parents of children with CF, siblings of people with CF, spouses, and adult children of people that have CF. So you can see in this graphic that our membership currently is about half and half, family members of people with CF and adults with CF. Our goal is to grow this group to over 600 people this year and to have it be a group that truly represents the entire CF community. So in 2016, in a large part due to the efforts of Kristen and the outreach committee, we grew 36% and are currently at around 300. Well, actually today we just checked the numbers and we have 350 members. So hopefully after this conference and getting the word out, that number will jump up quite a bit. You can see in the top left hand the geographical spread. So we have people all over the country, a variety of age ranges. We are currently more female than males, so we're hoping to bring in more males to this group. So some highlights from 2016. This group was involved in a wide range of projects and had a tremendous impact on a lot of different things, and you're going to hear that more today from the panelists. They participated in 12 different surveys. These had impacts on web content, so what kind of content do we need to develop for cff.org that we don't currently have, how to prioritize different projects to make sure that we are really investing in the projects that mean the most to the community. This group had input on clinical trial design, which Ali Sue is going to talk about. There were 6 different committees at the foundation that recruited new members from this group. They also joined the CF Care Guidelines group, had input on those projects, research projects, which David is going to speak to. There were 4 different focus group projects where members gave in-depth information on how we should be designing different programs and resources. And then they were instrumental in the development of a virtual event for people with CF called BreatheCon, which Chad is going to speak about. So with that, I'm going to turn it over to Chad Reedy. I'm sorry, this is the wrong last name on the slide. I'm sorry, Chad. Chad Reedy is going to be presenting next, who's an adult with CF.
Thanks, Christina. That's okay. I can't see the slides, so I won't know nothing. So, as Christina mentioned, my name is Chad Reedy. I am an adult with CF. I'm 35 years old. I was diagnosed when I was 3 years old, and I've been fortunate enough to graduate from college. I work full time. I'm married almost 10 years now in July, and have 2 boys. excuse me, obviously they mean a lot, and they keep me on my toes. So enough about me. Excuse me. A couple of years ago, I got really sick to the point where a lung transplant became a real-life option. That was the first time that I had really felt the effects of CF, not from a physical standpoint, but from a mental health and just an overall toll personally on me, and just how truly isolating CF can be as an adult, especially since, for reasons why I'm remote, we can't always get together and be in the same place. So after stabilizing my health, I decided that I wanted to get more involved with the foundation and try to address some of the concerns that I had about not having, as an adult with CF, not having resources or connections with a community that experiences so much of the same things that I do. Maybe, as Christina said, on in different ways, but can truly understand what I was going through. So I decided to reach out to my doctor, who was Dr. Boyle, and who had recently left and joined the foundation. And after talking to him, he put me in contact with Drucy and was able to have a discussion about my feelings on the lack of resources for adults and how isolating the disease was and how helpful it would have been for me growing up to potentially had the opportunities to connect with folks that had CF and talk to them about what I was going through and what life was like living with CF and some of these milestones about going to college or getting married or even having kids. So Drucy asked me to sign up for the, at the time, adult advisory, and I did. And it was had one of the biggest impacts to date in my life by signing up for that and getting involved. I have been able to participate in some really cool and different opportunities in a huge variety of areas, from focus groups on lung transplantation and the effects that could have and needs for it, to the website reorganization and filling out surveys and moving around topics to where I thought they would best be, to actually even being able to host a webinar on Social Security benefits and what the changes were. But as Christina mentioned, one of the biggest impacts that being involved in the community voice has been for me was being involved with BreatheCon in 2016. And the impact that it had on the adult community. When we started with that, we all thought that it might get 50 to 60, maybe 75 people. After months of working on it and with the help of the foundation, we ended up having 187 people register. And the feedback was incredible. It really provided a avenue for adults with CF to connect with each other and to form bonds with each other that could talk and discuss, typical issues that we all deal with and the struggles and the joys in a safe space where we weren't all together and potentially passing back and forth infection, but can still connect and talk to each other virtually, much like this, although I was able to see everybody and not just the wonderful panel sitting at the table. But it was a huge impact on not just on me, but on the community, and really provided an avenue for all of us to get together in a space that we normally couldn't do. We had people that were in their hospital rooms. We had people that were at home with their kids. And so it really allowed us all to get together and have an incredible impact. And lastly, one of the other things that has provided an impact for me. I've been able to participate as a mentor in the pilot for the peer-to-peer mentoring program, which I understand should be available to all adults by the end of the year. I hope I'm not misquoting anything there. But those two avenues really provided resources that up until now I never had and definitely didn't have growing up. And it was through community voice that these things materialized. When I got involved, I didn't think it would happen within a year. And I'm incredibly proud that I was able to be a part of it, and that the foundation and the CF community itself came together to create something like that. So before I turn it back over to the next presentation, I just wanted to encourage everyone who has thought about wanting to get involved, who is hearing about this for the first time, to get involved. To me, as Christina said, one of the best things about Community Voice is you can still be involved locally and fundraise, and you can see the direct impact of what those dollars that you've raised are doing. They're creating avenues and places for people to directly impact their own care. It may not be with a doctor or through research, but mentally in creating communities for people to get together that normally can't. So I know that you've all have probably heard this before, especially since you're all here at VLC, which means you're already involved, but you can't make an impact if you don't get involved. So thank you. We're making an impact, and I appreciate everything you all are doing. Thank you very much.
Thanks so much, Chad. Chad is a true trooper. He just stepped in last week to join this panel because we had somebody that got sick and wasn't able to join. So thank you so much, Chad. Your story is truly inspiring. Up next, we have Ali Sue, who is going to talk about how she's used this group in the clinical trial space.
Hi, everyone. Thanks, Christina, and thank you again, Chad, for sharing all the amazing work you've been involved with. From my perspective, I work on the clinical trials team at the foundation, and I'm just going to give you sort of an overview of the different types of projects that the Community Voice Group has helped us out with, and they've really improved, I think, the quality of work that we've been doing over the past couple of years. So on this first slide, I'm just going to sort of quickly run through the breadth of work that Community Voice has been involved with, and then I'll go into a little bit more detail about a couple specific projects. But just to give you an idea, they've participated in surveys that influence study design. They've influenced market research that sort of directs our entire department's priorities. They've spoken at meetings such as the North American CF Conference and the Therapeutics Development Network Spring Meeting, which is our research network meeting. They have reviewed materials for us. So these are infographics, which some of them are available at our program table outside, presentations, training modules, things that go on the website. They have beta tested and provided feedback on some really cool web tools, which we will get into in a little bit. And as Christina mentioned, they've participated on focus groups and actually done one-on-one interviews as well to provide some more in-depth feedback on specific projects. So one really awesome example of the way this group has influenced our work is this clinical trial feasibility survey. So what this is, it's a survey that asks about barriers and sort of the burden of a clinical trial and its design. And the idea here was to get people's feedback to make sure that in the very, very early stages of drug development, when you're first designing a trial, that you're not creating unnecessary burden for someone who wants to participate, and that the study design is actually feasible and practical. So this was a really, really cool and unique opportunity for people from the community to provide their input in the super early stages of drug development before a clinical trial is even available for people to enroll in. Another cool example are these infographics. So two of these, patient safety in clinical trials and then the clinical trial process, are available. We have copies on our table. You can also get them online. And then the one in the middle, CFTR mutation classes, is coming soon. And I know this was actually brought up in the earlier presentation as a question, is there a central place where it lists all the mutations and what therapies may or may not be potentially helpful? So we actually are going to have this printed very soon. And it'll also be going up on cff.org, and that one explains the major mutation classes and the different CFTR modulators. So all of these infographics have been reviewed by people from Community Voice, so they provide feedback on how easy they are to understand, whether the flow of information makes sense, and then in a broader sense, sort of the idea, the impetus for creating these comes from the feedback we get from the Community Voice group, because they tell us what information is missing from our website and what resources they want to see. This is my personal favorite. So these two web tools launched last summer, the Drug Development Pipeline and the Clinical Trial Finder. So both of these tools actually existed on cff.org before, but they weren't very interactive or intuitive, and not very many people knew that they were there. So the idea here was to create a really cool interactive space on our website where you could go find the latest updates on all of the drugs in the pipeline and all of the clinical trials that are currently underway. And we had people from Community Voice participate in focus groups and interviews from the very, very early stages of this project to tell us what they wanted to see from these tools. And then once the tools were built, we also had them go in and beta test and fiddle around with them and tell us what was working, what wasn't, and what they wanted to get out of them. So, for example, you'll see on the left-hand side of the screen, you can filter by different criteria. The therapeutic approach, your age, location, mutation. So all of those filters came from feedback from the Community Voice group saying, when I go to search for a trial, I want to be able to enter my zip code and see what's near me. Another great example on the drug development pipeline is that we now display discontinued drugs and a little explanation of, what phase they were in when they became discontinued and why. So before, when a drug was no longer being pursued, it just dropped off the pipeline and there was really no follow-up. And particularly if you were in a trial for that drug, you want to know what happened to it. So based on feedback from Kristen Dunn, who is one of our beta testers for these tools, we now include discontinued drugs in the pipeline, and they remain there for you to see, and you can read up about where they left off. So these tools have actually, I don't want to misquote the statistics, but I think the new drug development pipeline was viewed 100,000 times in the first 6 months.
It was 102,000.
102,000 times. And it certainly was not getting that traffic beforehand. So, especially because this is such an exciting time in CF research and we have all these drugs in the pipeline, we knew we had to be more transparent and make this information more accessible. And this wouldn't have been as successful of a project if we didn't have that feedback from the very early stages telling us how to make these tools successful. And the last thing I'm going to talk about is this new clinical trial awareness campaign. So you guys may or may not be familiar with I Am the Key. That was a previous awareness campaign that the foundation put out about clinical research. And the idea there was just to educate people about clinical trials, what they are, and why it's important to participate. So we have a new campaign that we're launching. We heard, again, from the Community Voice group that messaging, I am the key, isn't really resonating anymore. And it would have, while it would have been successful at a certain time, it's been a few years and the landscape of research has really changed. So because of that feedback, we decided to create a new campaign, something that is fresh and current and resonates with people now. And we participated in one-on-one interviews with a number of people from the Community Voice group to help us shape the very initial idea for the campaign. And now that we are sort of in the mid stages of development where we've got some more mock-ups of visual materials and examples of messaging to show, we are going to organize focus groups with the Community Voice group so that they can review all of that and give us their feedback. And then we're also going to launch broader surveys as the campaign is rolled out to sort of gauge how successful it is, whether it's resonating with people, and tweak from there. So overall, I think the Community Voice group has really been an invaluable resource for our department. Everything from, editing one sentence of an infographic, all the way up to helping us decide what direction to take with our projects on the scale of our entire department. So I hope you all will consider signing up, and then maybe you can be some of the focus group and survey participants that help us shape this campaign. Thank you.
Thanks, Sally Sue. It's exciting to see the impact that this group's had on the clinical trial space. So up next, we have David Hansen, who is the father of 2 daughters with CF. And David was actually one of the very first people to join the AFA, formerly now Community Voice. So.
Thank you. It's a privilege to be here today and to be able to talk about my experience with AFA and the Community Voice. Let's see. Which button? Sorry. It's the big one. Okay. I'm here to, like I said, to talk about my experience with Community Voice. And as Christina said, I signed up pretty much as soon as I heard about it. I never really, I'll just be honest, fundraising is just really not what I'm good at, or it's not my thing. And it was kind of the only thing that was available. Fundraising was the only thing that was available, and so I just didn't feel very connected. And frankly, as a dad, I was kind of in that unfortunate, stereotypical role of not being very engaged in the CF stuff with my girls. You know, I didn't know the medications, and I went to doctor's appointments sometimes, and for whatever reasons, but I just didn't feel very connected. So when I heard of this opportunity, it came through our local clinic. I signed up right away, and to say that it's been transformative is an understatement. It has completely changed my engagement with my daughter's CF. It has completely changed my drive, and it's been an outstanding opportunity. I can't plug it enough, honestly. So I've been involved in a variety of things since I joined. Surveys of all kinds. I was in this CFF user testing. I joined a committee, the Patient Family Advisory Committee, been on a focus group, and I also participated in a research project where I actually just did grunt work for a research project. It was great, actually. I learned a ton. And so it took me from this place of being just kind of a sidelines dad to, I feel like I'm really involved in the CF community, which has been great for me. If I can take a little bit, so probably the highlight, obviously, has been my work in the committee, and I want to talk about that just a little bit. So it's the Patient Family Advisory Committee. I was recruited. I've been part of the committee now for 2 years, and I went from really, again, not very involved to this. I volunteered to be a co-chair of the committee. And so I've been helping lead the committee now for a year and a half. And at NACFC, we launched the Insight Registry Research Project across the country to all of North America. And it just kind of blows my mind when I think about where I was and where I'm at now, and the level of engagement and level of involvement that I'm able to have. So I'm leading this committee. I'm leading a national-wide effort, that's reaching out to the community so we can provide information to the community that they think is important. So we can build research projects based on your submissions to the foundation, put them back out to you for you to vote on and prioritize, so we can do the research that's most important to you as the community. And whoa. I talk with my hands a lot, sorry. I help with that, and that's just absolutely amazing. But the beauty of Community Voice is there's just this huge spectrum of engagement opportunities. So, like, this committee has been a huge commitment, right? Many hours. I've spent tons and tons of hours working on this community, the committee over the last couple of years. As opposed to some things that have just taken minutes of my time, just fill out a survey. But they're all important for us as the community to be able to help the foundation help us even more, right? By helping get our perspectives shared to the community and get our perspectives and our voices heard. That's the beauty of this name. It's Community Voice. It's our voice that we share for the betterment of all of us. So, and this isn't, community voice is not instead of. For me, it is, because it's just, again, fundraising is not my thing, but this is an addition to activity that it's an opportunity for anybody to get involved at kind of whatever level works for them, right? So, and that's the beauty of it. They send you an email and they say, hey, we have this opportunity and we think you might be a good match. And you take a look at it and you decide if you have time or not. And they tell you, you think it's about this much and it's going to involve this, and you say yeah, or no, I just don't have time for that right now. But you continue to get those things as long as you're in the database, and you continue to be active in the foundation. And again, for me personally, it's just I feel more engaged. I go to every single clinic visit. I know every medication that my daughters take. I really feel connected. And that's been super important to me. And so, like that's everybody's story, but it's an opportunity to be involved and get to have your voice heard. So thank you to the foundation for to continue to reach out. I'm continually just overjoyed with how amazing the foundation is and the work that they do to listen to us and to provide us opportunities. And it's just up to us to take advantage of their sincere desire to hear our voices and to bring our perspectives into the work that they do every single day, and to progress all towards that cure, right? So thank you, and that's it.
Thanks, David. So I'm going to give a quick plug for everybody here and those online to join Community Voice, and I'll just fill you in on some of our goals for 2017 and moving forward. The first is that it's really important to us to increase the diversity and broaden our reach of this group. We want to make sure that everybody who wants to have a say has the opportunity to have a say. So that's one thing. The next is that we obviously have new branding, a new name, a new look and feel. We're also sending out some member gifts to everybody who joins. We want people to feel like they're a part of a community, and we'll be doing more efforts to increase the communications and engagement. And then we're also working to increase opportunities in research and advocacy. And as we'll hear throughout the conference, these are two areas that are critically important. We're going to be doing more in the research space to involve people at a deeper level earlier on in the drug development process and through all of the different projects. So everything that Ali Sue talked about, we're going to be doing in a bigger and broader way, and then partnering with Mary Dwight and her team on the advocacy space as well. So if you want to get involved, here's the steps. First, you go to cff.org/community voice. You'll see a big blue button there to sign up for Community Voice. We really encourage you all to do so. It's just a great way to get plugged in. And if you're really excited about it, we hope that you'll tweet or share about your experience using the hashtag CFVoice. And then for those of you in the room, we have sign-up sheets to get involved as an outreach champion. So this is a part of the outreach committee work. We'll be trying to touch into your experiences and to your networks of people to see how we can spread the word even further. And then for those of you that are online, if you want to get involved more in spreading the word, please email us at communityvoice@cff.org. So now it's time for us to take some questions. To submit questions, please go to cff.cnf.io and select this session. It's the outreach breakout, and click Ask to submit your question. So I think we have a few already. So one of the questions that came in was, why did we decide to change the name from Adult and Family Advisors to Community Voice? And does this mean that the Adult and Family Advisors group no longer exists? So this is actually kind of a funny story. We were presenting about the work of this group after its first year. And we had a big department meeting with lots of folks from the foundation, and Preston Campbell is going to be mad at me for saying this, but he was like, this is great. I'm so excited about this work this group is doing, but the name just really sucks. And I think it was some of the best advice that we got, because it did suck. Nobody needs another acronym in their life, and it didn't really embody the spirit of what the group does. So we sent out a survey to the group and asked, what does it mean to you? And the community and being able to share your voice were the things we kept hearing, and so that's why we settled on the name Community Voice. So yes, CF Adult and Family Advisors is no longer the name for the group, but everybody that was currently in that group is now a member of Community Voice. So change of name, but not change of group and mission. The other question is, if I join Community Voice, do I have to do all of those things? I don't have time to be on a committee, to be in a focus group, to answer all these surveys, and work on all the projects. So, Chad and David, do you want to answer from your perspective?
Is this on? Great. Yeah, absolutely. And that's really the beauty of it. They send you an email and you just ignore it if you want to. Just don't answer. But really, I mean, they have a database, and so I was involved in my committee just recently added a bunch of new people who are in the room today. Thank you I know who you are. And they have a database, and we set up this questionnaire, and we went out and we matched people, and we sent them an invitation. We heard from some people, and we heard from and others we didn't hear from. And always before, if it's going to be a big effort, there's an interview process. Well, they'll get a hold of you, and it's not really an interview. It's a gauge of interest. Conversation, and whether or not you'll be able to commit to what we're looking for in the activity. So there's lots of opportunity for you to say, yeah, that's a fit for me, or no, it's not. And you're still get like there's stuff that I just didn't respond to, and they keep sending me things. So don't worry about if I don't respond to everything, they're never going to send me anything again. That's not how it works. If you're a match, you're going to get an email, and you potentially have the opportunity to participate.
Chad, do you want to add to that at all?
Yeah, I will. I had a lot of the similar experiences locally. I've been very involved with the fundraiser on our local level, so that takes up time for me. But I have had the opportunity, like David said, to turn down things, right? I mean, when you fill out that form, it asks for your areas of interest and what you're passionate about and what your strengths are, and they gear what they send you to what you selected you want to be involved in. And, I've done, I've done a 5-minute survey because I knew it wouldn't take me any time. I could sit at my desk while at work and do it real quick. But I've also been involved in, the BreatheCon working group and, co-chairing it for 2017. And those are much more time consuming. But the great thing about it is it gives you that flexibility to say, yes, I want to participate in this, or no, I don't. And they won't stop sending me emails. And so if you're too busy right now to do more than surveys, or clicking on words and grouping them together so that they can better organize the website, that's all you have for now. That's great. If not, in 6 months or a year, you may find more time and want to get involved in a more time-consuming opportunity, and those opportunities will be available for you. So I highly encourage, don't let it, just because you don't have time, don't not sign up, because you'll be able to find time for some of those things.
Yeah, and as the staff member that's sending out a lot of the asks, that's absolutely right. There's no pressure to participate in everything. We just try and get it out there. So if you want to participate, you can. If not, that's totally fine, and it's not like we're going to quit asking. Another question that we got is, do you have ideas to get families involved who aren't as likely to participate in local events? Chad, do you want to speak to that? Do you have any suggestions there? So
I guess, so I'm understanding correctly, the question is how to get involved nationally instead of potentially just locally?
So I think the question is on how to get people who aren't as plugged into local level events and things like this. So I don't know if BreatheCon was pretty successful at engaging a lot of new people. Do you have any?
BreatheCon, we initially set out as a grassroots sort of effort. We initially didn't want the foundation to send out emails on our behalf, even though they were more than willing to. We wanted to use our networks and sort of spread it through social media. So, I think some ways you could do that to get engagement for people who may not be as involved locally is to constantly be talking about it through social media, or if you have people that through your local foundation that don't do as much, reaching out to them personally and saying, hey, look, here's an opportunity for you to get involved in helping shape the direction of what the foundation chooses to do and how it impacts those of us with CF or who are impacted by CF, and just show them that it's not a huge time commitment if they don't want it to be. It's a way it's a way for them to do a lot of this stuff from home and not have to, be involved with many people locally if they, have concerns about that for some reason. So I would just say, the word of mouth is a powerful tool, right? Spreading that word and talking about it will raise awareness. And if we don't talk about it, then people won't know about it. So the more you can spread it and, through social media, if you participate in a survey, talking about it, saying, hey, I just participated in this survey about reorganizing the website. Sorry, I keep going back to that one. But, that way I think that's probably the best way. If they're not involved locally, they may not be getting some of the emails from the national chapter about these things or from their own chapter. But if you know who they are, reach out to them personally, because every family member or person with CF can have an impact through this group. And the more impact, the greater this community will be.
Thanks. So there's another question on if there are materials available for chapters to have at upcoming Great Strides walks to help recruit people. The answer to this is that there's boxes of materials on their way as we speak to all of the chapters. For those of you in the room, you can see there's the new Community Voice pen/highlighter/stylus that we're super excited about. So we'll have those and some buttons and brochures as well. There's a program table downstairs for those that are here in person. For those of you that are online, shoot us an email if you want to join, and we can get you more information.
So just to relay how I got involved, I got involved because I put my email address on a list someplace, right? So that's as effective as anything. But this really is a grassroots effort that it's going to be word of mouth and getting the word out to people. But definitely the local centers have a real opportunity to pitch this to their to the patients and families that come in and say, this is an opportunity for you to share your perspective on this condition. So it really can be just as simple as, hey, we'd like to send you some information on this community engagement. Do you mind sharing your email with us, and then go from there?
Another question that came in is, what do you see as the key initiatives for Community Voice right now for the young adult and adult community? And to this, Chad, do you want to speak a little bit about what you are planning to do with BreatheCon and speak a little bit about the mentoring program as well?
Sure. So as I mentioned, last year BreatheCon was about 180 or so people who signed up. I think we had just more than 100 each day. So going forward with BreatheCon in 2017, we've actually creating another BreatheCon, which is a 2-day event where we hope to have even more than the 187 people sign up. And there's also 2 mini cons, they're called, around subjects. So one is on transition, so dealing with, potentially going from high school to college or college to the workplace or getting married or having kids, et cetera. And then also one on transplantation. But so part of that goal is to create these opportunities for adults and young adults with CF to be able to get together and learn and inspire from each other and have some people to talk to that have either gone through those things or are going through some of those experiences. Because as we all know, we have incredible support people who don't have CF. But, and I say this with the utmost respect for everybody in this room, unless you've lived it, you can't really empathize or sympathize with that person. You can't really understand what they're going through. And so we are trying to create these avenues and to have those people get together and share those experiences with each other so they can understand and not feel like they're by themselves and maybe learn from somebody else what they're going through. We're doing that with BreatheCon, and then with the peer-to-peer mentoring program that I've been involved in. I mean, when I grew up, if I had somebody that I knew I could potentially pick up the phone to and say, I'm getting ready to go to college, I'm worried about having to do my treatments in front of people, or, what it was like to have a resource and an avenue to go to talk about those things, would have been very important to me. I don't know if I necessarily would have used it to say, but to know it was there would be very important. And so by creating these folks that are willing to share their story and willing to listen to others, we're creating these relationships and areas where people can go to ask information or to answer a question, or just to talk to somebody who's been through it. What's it like to have 2 kids and have CF, or what's it like to be a new dad with CF and a newborn? So I think those are some of those focus areas, and in getting other people engaged, that as the population gradually gets older, there's valuable resources there for not just people with CF, but for parents and for each other. And so I think that's an important focus point that we're trying to emphasize.
Yeah, and one thing that I would just add to what Chad said is that both of those programs came from the community. And so by joining this group, it gives you the opportunity to tell us what we should be doing that will help meet those needs of the young adult and adult community. And then hopefully, that's what our department is here for, is to try and create programs that are supportive of the community. So another question that I have is for David about what is the plans for the Insight CF program going forward?
Right, so thank you. So if you're not familiar, just a quick synopsis of what the Insight Project is. We sent out a survey in November of last year, and it ran for 3 months, and we gathered ideas about research projects that could be done using the CF patient registry data. And we received over 400 submissions from the community about research ideas, and with the idea that this is a community-driven research agenda, and I don't know if agenda is the right word, but these are, instead of ideas coming from academics or from the foundation, or this is research projects that have been thought of and are important to the community and been voiced by the community. So we took these 400. Where we're at is we took those over 400 submissions. We're taking them and making sure. We've whittled it down to questions that can be answered using the patient registry data, and we're going to take and put the final list of questions back out to the community for them to vote on, to say, okay, of the questions that can be answered using the registry data, these are the ones that are most important. So we're going to be, in the next, I think the end of May timeframe, we're going to be sending out another survey to the community, asking you to rank, here are the questions, these are the ones that are most important to me as an individual, and we'll take that collectively across the community, and then the foundation will take and build research teams and get these questions answered, and have research projects that we hope that will show up at NACFC and will be published in journals, and that will be driven by the community, and then, of course, back out to the community and say, hey, these are your questions, and this is your answer. So the next step is to get those questions out, and we need your participation to vote on those questions and tell us what you want researched using the registry data. So yeah, and again, I want to emphasize, how this committee works, right? So there's a foundation component, and then there's a community component, and we are on equal footing. Our voices are, as important and as loud as the foundation voices. It's just the foundation voices has all the resources, right? Which is great. That's what we need. But it's truly a partnership, and that's the beauty of it. So, and that's the potential again of community voice.
Thanks.
Thank you.
So we have a couple other questions here. One is about if there's plans to engage more with the Spanish language community. The answer to this is yes. There's a large project underway right now to do research into how we can better serve and meet the needs of this community. We definitely recognize that it's an underserved area, and so we're working to expand that. And to start that project is to understand what those needs are and how we can meet them. So we're in that process right now. Another question was, are items going out about community voice to CF care centers? The answer to this is also yes. We're sending similar boxes with the information about the group out to care centers, and are going to be in touch with the folks at care centers. One of the groups that we initially reached out to when we launched the AFA originally 2 years ago were care center staff members, and especially the social workers and the nurses and the people that are doing having a lot of the conversations with community members, and they were awesome in partnering with us, and have actually we've had a few care centers that have used this group on different kinds of projects. So there was a researcher doing stuff on family planning, and she reached out to us and was able to get connected with members of the community to be involved in that research project. So it truly is a partnership between chapters, care centers, the national staff, and the entire community. So it's pretty incredible. Another question is there anything for younger teens, the 12 to 15 age group? This is something that we probably won't get to this year, but our hope is to definitely, I think by the end of 2017, our hope is to launch Community Voice to teenagers. We're, trying to figure out how to engage that group. They're a little more challenging to get engaged, but our plan is to definitely do that. Alicia, do you have something to add to that?
Yes. Even though there's no official avenue for teenagers to join Community Voice yet, specifically with that campaign I just talked about, we really, really want to talk to teenagers because that's an important group that has been neglected often in the past in terms of our messaging. And we want to talk directly to them just about, what's important to them and what resonates with them. So although Community Voice won't officially be onboarding teenagers, there are definitely opportunities for them to be involved and to make their voices heard, just with specific projects. That's Foundation.
Chad, there's a question for you that asks if you would be willing to tell us how old your two kids are.
Oh, I didn't. Sorry. I guess I got so emotionally caught up that I skipped that part. Yes, they are 6, although my oldest would tell me to tell you that he's almost 7 in June. So he's like 6 3/4, I guess. And the youngest one just turned 3 in January.
That's great.
Awesome.
So they definitely keep us very busy.
There was another question here about how this group compares with the CF Learning Network and the CF Care Model of the Future program. We've partnered some with these groups. Those groups are really based out of the medical department and housed at specific care centers. Our goal is to make sure that, as we move forward, we're doing everything in alignment with each other. So we've been talking with Paula Lomas, who I think I saw here. Yeah. So working with Paula Lomas to try and make sure that these programs are all connected and that we're all moving forward together. So that's, yeah.
Would you say that the community voice is a resource to all of those types of activities across the foundation? I mean, that's been my experience.
Yeah, so a lot of those groups, they come to Community Voice to recruit new members. So whenever those kinds of committees are looking for people to join, they come to us, and then we send out a request and see if anybody's interested in getting involved. So, Chad, Ali Sue, and David, do you have any closing thoughts that you want to share?
I'll go first because I don't want to follow either of them. I would just say that I, personally, and then certainly the entire foundation really, really appreciates any time that you have. I know you guys are so busy and already do so much, but it's really made a huge difference in the quality of work that we put out, because now when we undertake new projects, we know that we're giving the community what they want, whereas before, we have certain subject matter expertise, sure, but why are we qualified to say this is what the community needs? It didn't make sense. And this has completely changed the way that we approach prioritizing our projects and developing ideas for new projects. So I would say if you have the time, or even if you don't have the time right now and you think you might in the future, definitely sign up and just be open to all of the opportunities that arise, because even if there's only one that fits with your schedule, it could make a really, really huge difference in the work that we do.
I'll just chime in real quick and just say that similar to what Ali Sue just said, I would encourage you to sign up, because you don't know what may come across and what may spark your interest of how you want to get involved. And even if you have some idea that is a project or that, is an underserved area of the community, if you don't get involved, you can't express that, and you can't help to change the way that community is served. And as Christina said earlier, I joined this group because I wanted to give back, but I felt that with all the protocols for infection control and not passing infection back and forth, we were missing the opportunity as adults to get together and share our ideas and experiences and learn from each other and inspire each other to keep going as we get older and the disease gets harder. And without this community voice, that group may never have really been heard. And events like BreatheCon would never have happened, where, a group of us with adults with CF got together and used, as David said, the resources of the foundation to help us create this voice and serve a need that was there. And it's directly impacting the well-being of everybody. It may not be, increasing longevity of somebody's life through medicine, but it's improving somebody's day-to-day interaction with themselves and with people. And you can't make that impact if you don't join. So I would sign up and say, if you've got 5 minutes, that's still impactful. So please sign up, let your voice be heard.
So, I've been thinking about a number of different things to say, but I'm sitting here taking notes, because even this forum has given me ideas for my project that I'm working on with the foundation. I'm sitting here I want to create a Spanish language version of the final survey that we send out for Insight. Just the type of collaboration that is possible through these programs is amazing. And you think about the amazing work that happens with the fundraising effort and how much money is raised through Great Strides and through the different events and the wine tastings and all these different things that happen. And it's so powerful just the work that happens on a grassroots level. And if we could leverage that same energy now to, the community voice effort, it would make, like Chad said, we may not be developing the next, Orkambi, but if we can improve, the quality of life for our kids and for CF patients, that is just as important in my opinion, and that's what I think the power of community voice is.
All right. Yeah, can we get a shot of the room for Chad and the folks online? Can you see us, Chad?
I can, thank you.
All right, one last big round of applause for these guys and for everybody that's in Community Voice.